Welcome to Rethink My Health Radio Show. I'm Dr. Gez Agolli, Managing Director and Founder of Progressive Medical in Atlanta, Georgia. And this show, we come to you each week talking about healthcare matters that matter most to you, your family, your loved ones, but as I say time and time again, it matters most to us, the scientists, the researchers, the practitioners, constantly figuring out root cause. We're excited with this show because we are educating you. This show's not here to give you medical advice or replace what your practitioner is telling you to do. It's to enlighten you. It's to hopefully galvanize you to take action to make your health better, especially from a chronic disease perspective. Today's a very interesting topic. It's a topic that you might have heard of briefly, or you're not going to really hear about this from your family care practitioner, or really in most medical offices, they really just don't pay attention to this. We're going to be talking about heavy metal toxicity. More importantly, the toxic metal burden of heavy metals. Heavy metals are deleterious to your health. And that basically means harmful slowly. So it doesn't happen overnight, right? So what are heavy metals? Heavy metals are elements that can be in your water, in the air that we breathe, in the soil. And according to the Environmental Protection Agency, which puts out a report every year, I believe the last report was 2023, 2024, and that report talks about billions and billions of pounds of chemicals. These chemicals and heavy metals that we breathe, that we ingest through water or eating, it gets into our food supply, and it could be a small amount, but they're insidious and they actually accumulate. According to Harrison's textbook of medicine, the internal medical Bible for those medical students out there and for the doctors that graduated, they remember Harrison's textbook of internal medicine, chapter 17 on toxicology, that it talks about that heavy metals stay in your bloodstream circulating for 30 to 35 days. And then after that, they excrete from the body, from the air that we exhale, from our fecal matter, from bowel movements, from sweating, from the pores of the skin. The skin is the largest organ of the body and you're sweating it out. And of course when you urinate it. But what happens if you do not excrete it? It stores in the body's tissue. And this is where the potential damage is. Chronic disease, all-time high. Chronic inflammation, all-time high. Is it possible that heavy metals are contributing to this? Joined in the studio with me is an expert, Dr. Cheryl Burdette, and she is the Director of Education at Progressive Medical. She's Director of Education at Precision Point. She sits on several boards of nutraceutical companies. She teaches on numerous platforms across the world internationally. And this is a topic that Dr. Burdette has been discussing with other colleagues. So let's just jump in for the moment, Dr. Burdette. Heavy metals, let me just ask you a couple questions first of all. Why is it that most family practitioners don't even talk about this?
Yes, I think that is because of how we set up the definition of what is toxic. If you talk to a traditional toxicologist, and that's somebody who studies things that are toxic in the environment, the way that we set up the definition of that, what we should not be exposed to, is something called acute exposure, meaning that one-time dose is going to give a symptom. And then from there we said, okay, whatever the lethal dose is, let's divide that by half, and you shouldn't go over that. And that's how we have looked at it. However, there has not been an ongoing discussion of sublethal toxic dose, which is what you're referring to, and is still quite harmful. So you said, is it possible? I would say it's not only possible that toxins are affecting us, but it's probable and highly supported by the evidence out there. When we look at the evidence around asthma and allergies, there's not a debate in the literature. The research says that there's an environmental contributor, and that is decided upon. There's not really a big discussion around that. Now, on the clinical side, is there a treatment that addresses addresses it from that perspective? No, but the scientific community is in agreement that the reason that you see these escalating rates of asthma and allergies is because of environmental exposure. In addition to that, when we look at things like fertility, and we know small things are affected by toxins, right? This is why you're advised to not eat sushi when you're pregnant, because you have a small thing inside of you. Well, also other small things are, for example, sperm. And what they're saying about men is that all of our men will be sterile in the next 10 years if the rates keep up as they are in terms of drop of sperm count. And again, there's not really a debate about what the cause is. We know it's toxins from the environment, but from the clinical side, addressing it that way doesn't happen because we've defined it as, well, you have to have half of a lethal dose rather than thinking about sublethal toxicology, which is small amounts every day that you're exposed to that store in the tissue.
Absolutely. And it's a great point you mentioned that, because you're right, toxicologists are focusing on acute exposure, which is important, don't get me wrong, because there's some very bizarre diseases out there, especially neurological and things of that nature. But we're talking about the body burden, and that's why I use that terminology, heavy metals are deleterious, harmful slowly pertaining to health. So let's get right into what heavy metals we're talking about. So the most common ones are lead, mercury, cadmium, arsenic, aluminum. There's other ones out there as well as we look at the heavy metal table, but I want to focus on these for a second. Lead, some of the symptoms could be abdominal pain, headaches, fatigue, irritability. Here's the other key one, developmental delays in children, right? The EPA banned leaded paint, and of course, back in the 50s, 60s, and early 70s, we used to have lead in gasoline, and now we don't. We took it out, it's unleaded. But that lead actually leaked into the aquifers, because when they had the tanks, a lot of these tanks were holding gasoline, they became corroded. And it wasn't until Dr. Henry Schroeder, PhD, actually did some research with lead toxicity. And he was the scientist responsible for getting lead out of gasoline, which is a good thing, by the way. But what ended up happening is that we do have, unfortunately, some of these aquifers still have lead, of course. And that's why I always encourage any listeners out there, as I mentioned earlier, this show's about education. You should take a serious hard look on how you're filtering your whole house, actually, and looking for a carbon filter. Maybe not so much reverse osmosis, but carbon filter. So when you bathe, because when you bathe, and you know, we've had many, many patients come to Progressive over the last 27 years, and we've done certain testing, right? And we're going to talk about some of the testing in a moment. But we've seen some individuals just have skyrocket of lead toxicity that's accumulated in the tissue, and that's pretty serious. All right, so we've got the lead, we've got mercury, that we've seen patients experiencing tremors, memory problems, vision changes, and mood swings. Mercury also is a neurotoxicant. For those of you that had mercury fillings, when your dentist put it in, it's an amalgam, which is 50% mercury and 50% other alloy materials. It's very stable at that particular time, right? Here's the problem. When you chew and you have hot drinks, University of Calgary did a study in the 90s, and they published it, and it's called smoking teeth. And you would actually see vapors coming out.
Yikes.
So that's, you know, it's been published for information, and now a lot of dentists today are not using amalgam, which is a good thing. But I think also people ask, well, how did I get this? Well, here's the deal. If you live on planet Earth, you're exposed to heavy metals toxicity. So talking about those two, and we're going to get into the other ones in a minute, lead and mercury, the two big guns. And you mentioned something called lethal dosing. I do remember Henry Schroeder did studies with rats, and I read it. Lethal dosing of one of lead and one of mercury actually expanded to 100 times more toxic. That means if you've got lead and mercury together, it's 100 times worse. So that's pretty serious. Any other comments and research about those two?
Yeah, absolutely. So if you have something neurological, then walk or run, don't walk to look to see what your toxic body burden looks like. Because like you mentioned, these things are highly neurotoxic, but also treatable. And when I say something neurologic, of course, I mean things like Parkinson's disease, or you're not remembering things as well as you used to. But anything in the brain. So depression, anxiety can also be caused by heavy metals, and so, but yet some things that we all more commonly experience can be problematic as well. For example, one of the major reasons that women become osteoporotic with age is not merely just a drop off in hormones, but lead begins to compete at the bone site for calcium. Where calcium was going to bind, lead can bind more tightly. So over the years, as we're exposed to lead from the environment, and we're all exposed. It's in the air that we breathe and the water that we drink. And so as we're exposed, little bits get into the body, they compete with calcium, and now our bone sites have lead instead of calcium, and it's part of why they're more brittle. So if we can do therapies that pull the lead out, now we free up that site for those minerals to go back in, creating healthier bone, reversing some of that process. Also, cardiovascular disease. One of the major reasons that your liver will produce more cholesterol, will produce more lipids if it's not diet, is because it's irritated. And if heavy metals or toxins go through the liver, which they have to, that's your filter, it gets mad about that. And its response is to make more of these lipids, to make more cholesterol. So all the way from things neurologic to osteoporosis and heart disease, these heavy metals are having, as you said, a deleterious effect on us.
Absolutely, Dr. Burdette. Thank you for mentioning that. And also, since we're talking about lead toxicity and mercury for a second, let me pause with lead. Recently, it's been in the news that protein powders, right? Supposedly the good protein powders have high levels of lead. So I'm going to encourage all of you out there that are taking any protein powders to find out which brand you're taking. I don't know the brands, and I'm not here to disrespect any other brands, but obviously these companies are not testing for heavy metals.
No.
And there's a specific test, HLPC, piece of equipment they use, and they actually measure the amount, and you're supposed to have only a certain amount, particles per billion, okay? And that's why Progressive Medical and other functional doctors, they only use supplements that have a certificate of analysis to determine the heavy metal burden, because the last thing you want to do, you are taking something to make you healthy and you actually make yourself sick. As a matter of fact, we had a patient, Dr. Bouquet, and I believe Dr. Volsi, met with her last year, and they happened to come to my office and talk about this patient, and she had one of the highest levels of lead in her blood, by the way, which is unusual, because I mentioned at the beginning of the radio show that the lead stays in the blood for 35 days. So this is an acute exposure, okay? She was living somewhere in Europe, and she was a painter, and she was using and pottery, and she was living there for like 3 months. And she started noticing tremors, forgetfulness, irritability, and just a plethora of other symptoms, numbness and tingling. And I want to say that her blood was probably about 10 to 12 times higher, and her toxic body burden from the urine excretion, we did a challenge test, was probably about 50 times higher. Whew. Okay? She brought her husband in as well, and they both tested very positive. They went through a series of detoxification in 3 months, and it was interesting because she actually saw a hematologist because she had some issues going on with other concerns for cancer. And yes, unfortunately, heavy metals can contribute, I'm not saying cause, but can contribute to cancer. Anyway, getting back to this patient, she had probably 20 or 25 IV chelations, and she's a brand new person. And her levels have gone down to normal. Now, had she gone to different doctors, and of course, they would have probably not even thought about this. But
never.
Because we think differently, and we knew that her symptoms were very unusual, they were aberrant, they were not normal. Because she was living a normal life and just something happened like that. It had to be something in her environment.
And painters ceramics are so exposed to lead, so good history taking.
Absolutely.
This is what sitting with a patient for more than 7 minutes gives us. Sitting with them for 30 minutes, 45 minutes, an hour, so we can really figure out what's going on in their life, which, that was not going to happen someplace else.
No, absolutely not. Okay, so let's get into the treatment. So I mentioned this big word, chelation. It's a Greek word, right? Chel chelation. What exactly is chelation? What's a chelating agent? Is it safe? How do you administer it?
Yeah, so these are all things that we are well trained and experts at Progressive Medical. So happy to share our expertise with you, even right down to our protein powder. So go look at NutriCare at Progressive Medical for things that we have looked around, shopped, made sure, used independent labs that they don't have weird excipient ingredients in them. But then from there, if we're looking to chelate somebody, if we want to get those metals out, first of all, we need to make sure we're doing it in a healthy way. So we're looking at all paths of detoxification. Are you sweating? What are your bowel movements like? And so working to really build up the health of the person first. You don't want to take somebody who's in poor health and begin this process. So there's some foundational piece that we need to do. Then from there, it's really simple that there are equations for body weight for these various chelators, DMSA, DMPS, EDTA, that you get through various prescriptions, and we can do those either orally or through IVs based on body weight. And then we're going to monitor how the patient does, how you feel, if we need some kind of rescue recovery in between, maybe backing down on the things that pull the metals out, the chelators, and taking a minute to build you back up with antioxidants. And so it's a process, and it's a little bit different for every single person based on their symptoms, based on their body weight, based on the metal that they have, but we're going to surround them in things that are more protective. So for example, one of the things we like to do is look at your level of glutathione. That's your major intercellular antioxidant, and those that have better levels of glutathione do much better when excreting the metals from their body. Like, why did somebody store it in the first place? Well, low glutathione can be a reason for that, and as we increase glutathione, those chelators bind more tightly to the metal. They hold on to it better as it's pulling it out of your body, so it's less likely to kind of break free and just end up somewhere else in the system. But you know, a lot of us can use detox because not only from things neurologic to heart disease to osteoporosis, let's just say you've struggled with weight loss. That is a key one, a key symptom that can mean you're toxic. Why? Because these metals that float around for 30 days, the body's wise and it says, this damages my kidney, this damages my lung. If we can't get it out, we better package it up. So it does that, and it packages it up. I mentioned it could store it in your bone tissue, but it likes to store things in fat tissue as well. So literally, your fat tissue becomes a sink for toxins, and then that fat tissue becomes sick. And I know that sounds weird, but fat tissue can either be more to the healthy side or to the sick side. Of course, too much fat tissue is always unhealthy, but it's called an adipocyte. As a fat cell begins to collect more toxins, it makes less of certain hormones. And some of those hormones from fat cells say, hey, let's not store as much fat, let's break down more easily. But it makes it switch gears into, we got to hold on to fat, we got to keep it here because we need more of a sink for toxins. And so it's another reason that people can hold on to weight even though they're counting their calories and they're exercising more.
I want to talk a little bit more now with other heavy metals because, you know, we do mostly focus on lead and mercury, but there are some data talking about arsenic and cadmium, and you see arsenic, and many patients ask, okay, where do I get this from? And, you know, we talk about this time and time again. It's in the environment, it's in the soil, it's in the air, it's in the water. Some of the research you've done as well. You talked earlier in the previous segment how heavy metals can displace minerals.
Yeah.
So let's focus a little bit about arsenic. We've seen it in contaminated waters. We've seen it in pesticides, herbicides. A lot of these symptoms could be all kinds of different things. I know cadmium and arsenic are linked to cancer and other things. How important is it to assess all these metals besides lead and mercury?
Well, I think it's quite important to look at all of them because there's also a cumulative effect from various metals. You mentioned that negative synergy between lead and mercury, and when you have both, it's compounded, it's worse than it was otherwise. But if you also have low levels arsenic, low levels of cadmium, etc., alongside the higher levels of lead, or even without them, these things add up. Again, it goes into that calculation called cumulative body burden, and all of them count. arsenic is a big deal. It is in, like you said, it comes from the ground. Things that grow in the ground tend to pull arsenic into them. So most of our plants will have some arsenic. Grains are really bad. Rice can be really bad. So actually focus on rice from California. It tends to have less arsenic than some of the rice from other places. So we want to, and all of that continues to add to our system and continues to make us worse, and they all have impact on our body. So doing a panel that looks at all of these metals together will be so useful. The second reason that you want to look at a panel of metals together is because you won't necessarily see all of them show up initially. And this is because chelators, think of them like a shovel, and they can only pick up a certain amount. So if you have a giant pile or a small pile, that shovel goes in, and the small pile, the shovel goes in 3 times, it's out. The giant pile, it goes in, you keep shoveling, but then as you get rid of that first category of metals like the lead or the mercury, now other things show up because now there's room for it to grab that too. So it's a process, and chelators are going to grab a hold of certain metals first, and then as those come out, now you see your second wave of what was being stored in the body. So it's really important to look at all of these together.
That's such a great example, great analogy, because you're right. Chelation means to keel, it's like to claw. So you're basically, it's like a magnet. And you talked about the shovel, which is a great example. But I also like to talk about like a toxic dump site, right? You bring a truck there, and each chelation session, whether it's oral, whether it's intravenously, it's pulling out these metals. You can only take so much out safely. Let me use the word safely. You have to go to an experienced practitioner. Our practitioners have that training from the American College of Advanced Medicine, which are the leaders in safely chelating, and you have to establish the body burden, and that's through these testing of urine provocation, and of course you can do the blood levels as well. But as I mentioned earlier, sometimes it's not going to show up in your blood. So if you've just done a blood test, that, in our opinion, from a functional perspective, is incomplete because it's not challenging the body. Mm-hmm. As a matter of fact, I remember talking to someone that was suffering with neurological diseases. Yeah, they had MS, and they basically had a test done. It wasn't challenged, and it was normal. And then they went to another practitioner, and they did a challenge test, and her levels were through the roof. And they went on a course of treatment, and it made a major impact. Okay, so that's important. So it's really important. We encourage you guys to really look at the testing as well. And one of the most important things, of course, with heavy metal toxicity is to find the source. Mm-hmm. So we talked about, we're not here to scare, we're not using scare tactics to our listeners out there. Stop eating rice and stop eating all these different foods. We want you to be aware, mm-hmm. right, that heavy metals are in our environment. Dr. Burdette, is it normal for someone to just do like a chelation maintenance? What does that look like?
I think absolutely. So if you know that you have more exposure, and that exposure could be something that you work around, but it might be you just like sushi and you like a lot of seafood. We know that can be more contaminated with mercury. Now, hopefully look up on your phone or look up fish that are higher in metals and lower in metals, and try to shop for some of those cleaner fish to help with this. But again, we're all exposed. So taking a moment each year to do a detox program to move some of this out will help us preventatively. Like I mentioned, it will help to prevent osteoporosis. It will help to prevent cardiovascular disease. It will help to prevent cognitive decline. And so it's just a good idea. In the same way you would change the oil in your engine, we need to do this as humans as well. The second part is that it should be an ongoing process. So it's not just 4 weeks out of the year or 3 weeks out of the year, but we learn how to shop in a more clean way. We want to continue to keep antioxidants up in our body. If you have higher levels of glutathione, you more naturally excrete heavy metals. And then we want to think about what can we do to offset. Think about things like saunas. I'm lucky enough to have an infrared sauna at my house that I use regularly, and the research supports that. There's very good data from something there's really no profit off of researching. So that even tells you how much, more impressive the data is. Nobody's making money off of it. That shows that people who do saunas have a drastically reduced risk of cardiovascular disease. So why? Again, we're getting these metals out, we're getting these toxicants out on a regular basis. That's one way to sweat. But are you sweating? Do you exercise? Are you doing something to get toxins out of the body? Are you drinking water every day? Are you sweating? Are you doing things to keep your antioxidant level up? Are you filtering your water? Taking an inventory? Did you know the average woman puts over 100 chemicals on her body every day? By the time you look at the chemicals in the lotion and in the hair product and in the makeup and in the bubble bath and it quickly adds up. So we're under this toxic assault. Oh, and that's before air fresheners or different fragrances out there. So it's something that we need to learn more about and be very proactive about as well.
It's like chemical soup out there, right? It's just chemicals everywhere. And I always say this to a lot of individuals, if you heard me talk before, if you have a product and you cannot pronounce the ingredients, there's a good chance you should not be taking that product, right? It's loaded with chemicals. Chemicals and heavy metals are deleterious to your health. Hey, this is Rethink My Health. We're talking about getting to the root cause. We're talking about heavy metal toxicity. Why should you take action? Because our environment has been compromised. We live in a fallen world. We live in a toxic world. And if I can just say, if you can only do one thing, only one treatment, that's infrared technology, infrared saunas. And I know there's a lot of people out there that are saying, well, I'm not sure if I can afford it. And I understand that. I'm sensitive to that if you can't put into your budget. But there's so many options right now. As a matter of fact, there's an organization called Hot Works, Hot, H-O-T, Works, W-O-R-K-X. And they actually have infrared saunas where you work out. You can have yoga, you can do, and it's a video sequence of exercises, and you can have the bike, you can have the elliptical, you can have the rowing machine. It's very affordable actually, and you can just do a month to month on that. That is something, but if you can get one for your home, they even have portable ones. I don't have a comment on these blankets. I don't think you're gonna get a full detox as opposed to a regular sauna. I think the blankets are okay, but not for that full detox. You need to be sweating, and you need to follow mineral replacements and stay extremely well hydrated. You don't have to go very hot. A lot of times patients say, well, I have a traditional sauna in my gym. And my thought process, well, it's better than nothing, but you can't stay in there longer than 10, 12 minutes. That's unphysiological heat. Infrared is a lower heat, gets into the dermis, and it pulls out these metals. Okay, Dr. Burdette.
Yeah.
This is great stuff, and I'm so excited that we're talking about this. So I want to mention a little bit about some of the nutrition.